Nurse Retention Policy Implementation by Early Johnson. Me. Introduction. Nurse retention is the idea of ensuring that nurses remain in their working positions for a long period of time, so as to minimize costs or ensure best services out of them due to increased experience. This presentation outlines some of the guidelines which should be used in implementation of nurse retention as a development plan. Target audience. Organization leaders. The main target in this policy is organized leaders who have the responsibility to make crucial decisions and ensure that nurses have maintained their positions for better healthcare services. With good implementation of rules and policies governing the healthcare environment, these individuals may be the best target for this plan as they control the employees. Hospital administration. Apart from the leaders, there are also administrations which run the hospitals. The policy should aim at educating these administrations on the best ways of maintaining their nurse employees. Colleagues in community government. Colleagues in other hospitals may be another good target for this message, whereby the government can also be another potential audience since they implement all the country rules and regulations. Effects of policy implementation. Leaders. On organizational leadership, these individuals may enjoy much since the costs of hiring new nurses and training them would be highly reduced or totally avoided. Again, running the hospitals becomes much easier since one of the employees is fully aware of what is expected from them. Hospital administration. Using hospital administration as another target, the management may be pleased to reduce the amount of resources which should be allocated to the running hospital, hence more developments and returns from their operations. If the hospital is not hiring, it means that the costs which were originally directed to that activity may actually get into another use. Colleagues and community council. Colleagues may get an opportunity of improving professionally through getting experience and lessons from other nurses who have been in the game for long. The community also enjoys the advantage of getting the best nursing services since the employees are best suited for the job. Problem solved by the policy. In America, high turnover rates are the major problem affecting the healthcare industry. This policy helps in solving this problem as it is an option for reducing the cost of operating a healthcare facility. Some of the costs mentioned here is hiring of new nurses, incurring expenses when training them, and increased salaries, the overall recruiting process in general. Over the years, the quality of healthcare has been deteriorating. This policy aims at improving the level of healthcare in America to the benefit of each citizen. Policy plan and implementation. The policy here is to work on improving nurse retention so that the healthcare services can improve and nurses can remain in their positions. Implementation, payment and compensation. There are ways in which this policy can be implemented, whereby better compensation is the first step to achieve this. Paying the nurses well and offering subsidies and other financial opportunities may make them remain in their position for a longer period than expected. Professional training. Regular programs which develop the skills of nurses may be important since they help the employees in refreshing their skills and also gaining more knowledge which would be actively used in their practical work. Work-life balancing. The policy is focused on making sure that the plan accommodates time for nurses to have fun with their own lives and live their own lives. This involves giving the nurses reasonable schedules and regular breaks where their minds can rest for a bit. This improves the output given out by nurses, considering that their work is tiresome and requires concentration.